Good morning, everyone. I'm Carrie Roper, digital news anchor and producer here at the Las Vegas Review-Journal. Welcome to the Aging Wellness webinar presented by Optum Care, Network of Nevada. The topic we'll be discussing today is what you need to know during Medicare annual enrollment. Please make sure to click on the question mark icon if you have any questions. We do have an Optum Care representative on hand to answer any and all questions that you may have. Now let's welcome our esteemed panelists today. Please introduce yourselves, gentlemen, and tell us a little bit about yourselves and what you do.
Hi, my name is Scott Hansen. I am the United Healthcare Sales Director for the state of Nevada, and it is my team's responsibility to make sure that all of the licensed brokers in the Nevada market are educated and supported to sell all of our United Healthcare plans.
Wonderful. And Dr. Alamo, how about yourself?
Very good. I'm Dr. Tony Alamo. I was in the community as a private physician for over 2.5 decades and joined Optum about 3 years ago to lead the IPA team into the next level.
Wonderful. Well, we're so grateful to have you both with us today. We know how busy it can get. Mr. Hansen, let's start with you. You know, Medicare can be a very complex topic. Can you share some of the basics with us?
I'd love to. There are 4 parts of Medicare conveniently labeled A, B, C, and D, and each part helps pay for certain healthcare services, and each part has unique costs. It's kind of like building blocks, and these parts A through D can be put together in different ways to provide you coverage that you need. Part A is your hospital coverage. That covers you while you're an inpatient in a hospital or skilled nursing facility. Your Part B is your typical Medicare or medical coverage outside of the hospital. Part C is unique, and Part C is often called a Medicare Advantage plan. And these plans combine Parts A and Parts B, and often Part D, which is your prescription drug coverage, all into one convenient plan.
Can't get any more simple than that, right? And Mr. Hansen, who can get Medicare?
Medicare is available to citizens and legal residents who have lived in the United States for at least 5 years in a row. This is individual insurance. It is not family coverage. So individual insurance, and you're typically eligible based upon reaching age 65, potentially under age 65 with a qualifying disability, or potentially persons that have end-stage renal disease.
Good to know. And what is Medicare annual enrollment? We obviously, when we're enrolling every year, that we know that there's a specific time limit that we have, but how is Medicare annual enrollment different, and what is it?
Annual enrollment, also you might see it out in the market labeled AEP, or the annual enrollment period. Your medical annual enrollment period, or AEP, that's the time to enroll or make changes to your existing Medicare or Medicare Advantage health benefits. You can also select a primary doctor from a local provider during this time. And the AEP, or annual enrollment period, it starts each year on October 15th, so it's just started recently, and it ends each year on December 7th, so that end is coming soon. Optum Care Network of Nevada and Southwest Medical, which is part of the Optum Care network, they really invite you, along with United Healthcare, to choose the plan that best fits your needs. So we're kind of partners in this process.
Good to know. And as you mentioned, December 7th is the date to remember. And what important things should viewers keep in mind during this annual enrollment period?
Well, as I mentioned a moment ago, the AEP, or annual enrollment period, it's the time of year where you can sign up for a Medicare Advantage plan, but you can also make changes to your existing enrollment. So if you're already currently enrolled in a Medicare Advantage plan, you can switch to a different plan that may better fit your needs, or you can move from what's called original Medicare to a Medicare Advantage plan. If you're completely new and you're just turning 65 or you're just retiring, you have an initial enrollment period that is just before your birthday, the month of your birthday, and just after your birthday. So you have a special enrollment period as you turn 65, but this annual enrollment period gives you the option to sign up or make changes outside of that turning 65 scenario. As I mentioned before, if you're already a member, it's your time to make sure that you're in the right plan. It's your time to make sure that you're with the right provider and primary care physician. And then those steps during this AEP process, we invite you to work with a licensed broker to make sure that you're reviewing your enrollment periods, that you're researching your options, that you're asking questions. Check to see if you have any financial help or eligibility for some of our special plans, and then to go ahead and make that enrollment either in a new plan or to sign up for the first time.
All such wonderful information. And again, one more time, that last date is December 7th. So as you said, that is coming up quite quickly. Dr. Alamo, can you tell us a little bit more about the Optum Care Network?
Yeah, thank you for asking. We have two different kinds of programs here in Southern Nevada. We have the Optum Care Network, and then we have Southwest Medical, which I'm hoping as we go through this interview, I'll be able to elaborate on that as well. But let me go ahead and just stick to answer the question you just gave me. The Optum Care Network is a very large array of contracted providers of all levels that we have created here in actually the whole state. But let's talk about Southern Nevada. What we've done here is we have over 3,000 healthcare providers. Every hospital is contracted throughout the valley. It has primary care, it has hospital, urgent care, specialist care, long-term needs, labs, diagnostic, x-rays. It's what you see when you drive around, you see these neighborhood clinics, right? So you can see the big UMC, right? You have the big major UMC kind of operations, you have Dignity, but then you also have, UNLV, medical school, and you have the smaller primary cares that are all throughout the city. So what it does is it gives people choice, close to work, close to home, and it's the entire valley.
And Dr. Alamo, how does Southwest Medical and Optum Care Clinical Services fit in with the network?
Southwest Medical is a different system. It is an employed system where the Optum Care Network is affiliated. They're private practitioners that we have brought into our system. So let's talk about Southwest Medical. Southwest Medical is very similar to what a lot of our patients who are coming from other places, for example, California, and they're used to getting their health care in systems like Mulliken, Kaiser. What Southwest Medical is a place where all aspects of health care is vertically and horizontally integrated. What does that mean? That means we have over 450 providers, 5 primary care locations, 4 primary care locations within Walgreens. We have complete entities where we offer all services. We can offer radiology, imaging, lab services, specialty care, one-stop shop, and all that is employed and controlled by our entity. So, we offer here choice. Patients have the ability to go through the Optum Care Network and go to their community physicians that might be a block away from their home or their work, or they can go to these more centralized, vertically, horizontally integrated with basically one-stop shopping, where you can go to one place and offers all aspects of your health care. That's Southwest Medical.
I love it. And I'm just looking at the list in front of me really, really briefly. It says cancer care, lung and allergy care, palliative care, primary care. So you're absolutely right. There's nothing that it is that you don't cover. And I love to hear that. What a wonderful opportunity for patients to go and get everything handled right in one spot. Mr. Hansen, what about complex healthcare needs? Medically ill patients who have 2 or more chronic conditions that require ongoing medical attention or limit their activities of daily living. How does the network address those needs?
Yeah, it's really great to hear Dr. Alamo talk about and refer to choice. And in Medicare Advantage plans with United Healthcare, you have choice as well. There are a number of different plans within the Nevada market to choose from. And some of these plans are specifically set up for those with those complex health needs. So, for example, people with diabetes, people with heart conditions. Our network and our plans, they offer medical management programs, and they provide high-touch care, and this is coordinated through the hospitals, the skilled nursing facilities, right into a member's home, even in an in-home visit. And these programs all work in collaboration. They also work through a facility case manager, and they provide both pre and post after hospitalization programs. And it's really all tied to our goal of finding a plan that best meets the member's needs.
That's wonderful to hear. Now let's talk a little bit about how Medicare Advantage compares to straight Medicare. Mr. Hansen, what are factors that might lead someone to consider a Medicare Advantage plan?
Really, a Medicare Advantage plan offers everything that original Medicare offers, and then offers so many additional benefits over the top of traditional original Medicare. It takes those parts A through D that we were talking about a little bit ago, and then it adds important coverage like vision and dental and hearing. You have free gym memberships that come with most of the plans. So you have a lot of additional benefits that are important to an individual's overall health. They're included in a Medicare Advantage plan that aren't part of original Medicare. And then most importantly, that second piece of the pie that comes along with a Medicare Advantage plan is it limits the annual out-of-pocket costs.
That's wonderful to hear. And I had read as well that studies have found that patients who are part of that Medicare Advantage plan pay less overall for their health care and are less likely to be readmitted to the hospital than perhaps someone enrolled in traditional. And you had me at gym membership, I got to tell you right there.
Yeah.
How does the Medicare annual enrollment period fit in with Medicare Advantage, Mr. Hansen?
As we were talking a little bit about before, the annual enrollment period is so important because it gives you that ability to reconnect with your current plan needs, to make sure that you are in the correct Medicare plan for you. Either plan change gives you the opportunity to switch plans if you're already enrolled, and it gives you the opportunity to enroll into a new Medicare Advantage plan if you're not already in one. And you have just one chance to have that opportunity each year from October 15th to December 7th.
December 7th, we cannot say it enough.
And,
I'm sorry, one more time?
I said that's the key date.
Well, I have it now, December 7th, December 7th. Mark your calendars if you're at home. And one quick reminder as well, if you are watching us, please make sure that you're participating, asking questions. We do have someone on standby, a healthcare professional that can answer anything and everything that you're sending in. So make sure that you are participating. Dr. Alamo, older adults are clearly going to want plans that fit their specific needs at this stage in their life. What are some of the senior-focused aspects of the Optum Care Network?
See, I think, Mr. Hansen touched on some of the uniqueness of, this patient base. This challenging. This patient base could have some fiscal challenges, could have social challenges, and they could also have, medical, physical challenges. They can't always come to our offices. So we have to pivot. We provide things for them where they are. We come to them. Our programs are geared, very patient-oriented, and very detailed. I mean, we're very proud of our yearly wellness exams, which are exams with our providers that are 1 hour in length. It is very detailed. It goes into their history. We do screening tests. And of course, we'd love them to come to us. But when they can't, we go to them. We have a very robust home wellness visit program. We have 2 Optum Community Center nurse practitioners, as well as the network has also nurse practitioners that can go into people's homes. But then, of course, our members have access to 24-hour advice lines. They can talk to an actual nurse, run something by them. Sometimes they just need a little bit of advice, and that goes a long way. Other times, that conversation can get very serious very fast, and that nurse may tell them, you need to get to the emergency room right away. So these are kind of the things that we have to pivot on with these patients because they're challenging. They have challenges, but we pivot to make it easier for them.
I love it. And you just touched on something briefly that I just want to highlight, how you said that this is really comprehensive, that there's no time limit. Sometimes, oftentimes we can go into a doctor's office and we feel quite rushed, but now having that opportunity to have someone come home and really spend time is very, very important, especially for that particular age group. Dr. Alamo, it's clear that the ongoing COVID-19 pandemic has affected us all. How has it affected your senior-focused programs like the Optum Care Community Centers?
Well, first of all, remember these patients are the ones that are at risk. They're 65 and older, or if they're younger, it's because they have complicating physical ailments that made them eligible for Medicare. So they are high risk. That's number one. So these patients, definitely, we have to make sure we keep them safe and make sure that they have access to us, either physically, telephonically, or we go to their homes, right? So the community centers initially, we shut them down like everything else shut down. But as we started to learn more about the behavior of the virus, then we started to get smart as medical professionals, and we started to use common sense. We've opened up our community centers to a certain extent, maintaining limited class sizes, social distancing, a lot of hand washing. We make sure that we don't want to put them at risk. They're as safe as they are with us as they are in their home. If we can't maintain that safety, we won't do it. But the community centers are important because keep in mind, a patient that's cooped up, sitting in a home where they can't get out, they can't see their grandkids, they can't see their sons and daughters, they can't see their other relatives or friends, that affects mental health. So this helps them total body, mental as well as physical. We're very proud of our community center.
Absolutely. We've heard so much about, especially now with COVID and that isolation, how important it is to have something that connects us, whether it be through phone or through social media or anything. But the community center is something so important. Dr. Alamo, it is my understanding that the community center social activities are open to the public. Is that correct?
Oh, absolutely. You don't have to be our members. It's come all. I mean, we're here for you. So absolutely. We encourage everyone to come in and experience the community centers. And our doors are open in a safe manner.
And I was going to volunteer to come on down, but I did see it's only open to adults age 55 and older, but it is free of charge. So give me a couple of years and I'll be there, I promise.
Oh, you have a lot more than a couple of years. You've got a long way to go. Mr. Hansen and myself, we're a lot closer.
It sounds like fun, though. I want to come. So I promise you, once I hit that age, I'm there. If it's still going, which it sounds like it's going to be around for quite some time. Dr. Alamo, let's go into a little bit more detail about the features of the community center for plan members. You've highlighted it so well, but can you tell us a little bit more about some of those features that they can expect?
Well, once you become part of our program, so we're going to reach out to you. You have let's talk about the wellness first of all, which is a very big piece of our success and what's really embraced by our members. So we have primary care offices that we offer doing the wellness there. If you cannot, for whatever reason, come to our primary care facilities, which we encourage, we'll come to your homes. We can come on weekends. We also have, skilled nursing facilities to assist living, custodial care. We also have what we call Medicine on the Move, and that's a great program. It's an entire huge bus. The bus is a mobile clinic. We will come to parts of the city to make it easy for our members to come, and they can get their wellness visit there and their screening tests, even mammograms. So, we make it as easy as possible. Now, remember, we cover the whole valley. So we reach out to Pahrump. We go to the river cities. We have Laughlin and Bullhead. We have patients there. What I was saying is we will go to them as far as Bullhead, Laughlin, and if we can bring our Medicine on the Move bus, or we'll bring our nurses over there as well. We also have telemedicine, which is something that, the members are beginning to learn it. We're all having to get to know iPads, computers, iPhones. So we help them. We train them. In fact, we will bring out to their homes actual iPads so they can actually come and look at us through telemedicine and see their providers on screen. So I think this, it's being embraced, and I think that has a big potential to grow as that membership starts to embrace the technology.
I love it. You're really taking out any kind of hurdle that could potentially prevent someone from coming in and getting this amazing care. Now, Dr. Alma, let's go a step further if we can and get into some specific details about the annual wellness exam that you had mentioned.
Okay, well, for example, like I mentioned before, it can take as much as an hour or longer if needed. Obviously, if somebody is very concise with their history and is pretty healthy, it could take less. But the importance of the wellness is it's what our providers try to do prior to the visit. They educate themselves to the members. They try to get old charts, old records. Okay, so when the patient comes in, you already know the patient, at least medically. So then now that comes the history and to get into the deep dive of exactly what has transpired with you. What medications are you on? Make sure that the medications are correct. Sometimes, as you know, medical care gets fragmented and other people get involved in adding medications, and they may not realize there's contraindications with some of the meds. So our providers help work that through with the patient so to make sure they understand. As you're doing the visit, we have screening devices there. We can do things like EKGs. We can do spirometry. We can do tests that look at blood flow into the lower extremities. We can do urine tests, and all those things help in screening. So if we do find something, we can quickly direct them to their primary care doctors to get further care. The patients really embrace it, and on top of that, they also get a gift card for coming. So it's a win-win.
I'm telling you, you've got free admittance into the community centers. You get gift cards. I'm very, very jealous right now. And I wanted to make sure that we mentioned where the community centers are located. Dr. Alamo, can you tell us? And I believe we'll have an on-screen graphic too to help as well.
Yeah. So let me just I have look right here at the addresses. We have two locations, one on the west side, one on the east side. The west side is 8670 West Cheyenne, Suite 105, and I actually, from my office window, I can see it here. And on the east side of the valley, it's 5820 Southeastern, Suite 100. So we went to both sides of the valley, again, trying to make it as easy as possible for them to come.
I love that. And you had just seen those addresses up on your screen. We'll put them up one more time for you to take a look at. There's an address on the west side, West Cheyenne, as well as an address on the east side on Southeastern. Fantastic. Dr. Alamo, to wrap things up, let's talk about what is on a lot of people's minds when seeking medical care, which is access for appointments.
And like I mentioned before, this is the key to this program. When I came aboard 3 years ago, we had the Optum Network, which was smaller and defined in nature. And of course, we had what everyone well knows, Southwest Medical. With the vision of our president and CEO, Dr. Macbeth, he knew that we need to give our patients choice. So we grew the network side to where we are today, where we started with 8,000 members, and in less than 3 years, we're at 20,000 members. We almost tripled the number of providers and access. So that's the key. Patients need to have access, and they have it for both. If they want to get their medical care in a facility similar to what they used to, maybe where they lived in California, and they want to go to an employed program that's vertically and horizontally integrated, like Southwest Medical, we have access. You'll come right in. If you want to go to physicians that are close to your work or your home, and they're spread all over the entire state, especially the Valley, we can get you right in. If you don't have access, the system doesn't work. That's the priority, access. And that's why I think we've grown like we've grown.
Absolutely. And Mr. Hansen, before we wrap up, I'd like to get any final thoughts from you. You both have provided such wonderful information.
I would say no time like the present. If you have had questions about Medicare in your mind recently, now is the time to get those questions answered. We're in the middle of our AEP, or our annual enrollment period. It ends, as we mentioned, on December 7th. And if you're concerned about meeting with someone face-to-face, we can do business how you want to do business. We can do business over the phone, virtually via WebEx or a Zoom meeting, or with our great telesales teams as well. So now's your time. Don't put it off. Your health care is important.
I love it. Thank you both so much for joining us today. We really appreciate your time.
Very good. Thank you very much. If I can just add one more thing.
Please, yes.
And this has been kind of the motto that we've tried to kind of permeate through all our physicians. At the end of the day, we want to see you. And if we want to see you, then you're going to want to see us. And it has to be a win-win, and we're proud we're there.
We love it. And Dr. Alamo, thank you so much for all of your time. Mr. Hansen, we really appreciate it. That concludes our program for today. Again, thank you both so much for being here. We hope that this was informative and provided answers to all of your questions regarding Medicare and what to look for. Again, we'd like to thank Dr. Tony Alamo and Scott Hansen for being here today. And thank you to our presenting sponsor, Optum Care Network of Nevada, for today's webinar. You can catch all of our webinars on demand. You just simply go to agingwellnessexpo.com/webinars. Thank you again. Enjoy the rest of your day and please stay healthy.